Depression I think it's more than just feeling sort of sad or down for a couple of days at a time. I think we all go through periods where we feel unhappy and we feel fed up at times. But I think depression is more so when those feelings and thoughts are sort of consistent and persistent, and they affect your sort of everyday life. So we kind of think about it in maybe the milder sense of depression. So as I said, those persistent feelings of sadness or feeling down all the time. And whilst it may not be at the point where it's affecting your everyday life, everything just feels a bit more difficult. And then we kind of get to a point, or we can get to a point where depression is a bit more severe. These are the times where maybe it's more concerning because it can be life-threatening. We know that people who are severely depressed can go on to experience suicidal thoughts. And I think it's kind of being mindful and aware of that sort of persistent sadness, the impact that it can have on your everyday life. I think it's important to think about how depression is going to affect each individual person in particularly individual ways. So there are many sort of signs and symptoms. It can affect the way we think about ourselves and sort of think about the world. So we might be sort of racked with feelings of guilt or feeling quite worthless, or sort of question our place in the world, or kind of have low self-esteem. It can impact our emotions, so feeling sort of uncontrollably sad, feeling quite upset, tearful. But it can also impact us physically and in terms of the way in which we behave. Feeling more tired, for example. Sometimes people experience a kind of loss of their sex drive, a loss of appetite. And then in terms of how we interact or behave with the world, we might become a bit more isolated, or we might become a bit more withdrawn. And all of those different symptoms, as I said, can sort of manifest in different ways for different people. Again, it's keeping a track of those symptoms and thinking, how severe am I experiencing this? How persistent is this sort of sadness? How long has this gone on? And what sort of impact is it having on my day-to-day life? So is it affecting my relationships? Is it affecting my ability to work? Is it affecting my ability to sort of concentrate? And I think for each person, they will be able to maybe recognise that at different points. And so I think the best thing to do is think about, if you recognise that, if you recognise a change that doesn't seem to be going away after sort of days and months, to get the right support and seek help for it. Often I think there are kind of different sources of information that people can sort of interact with, but thinking about getting the right help and at the right time is vital. Speak to your GP if you have concerns, but then also think about well-known sources. So for example, Mind is a charity, thinking about accessing their resources to develop your understanding of what might be going on for you and what you might be experiencing and how best to go about managing that.